Okay, so today I'm just here to talk to you a little bit about the procedure that we've recommended you have tomorrow, and that is a cardiac catheterization. So, some of the reasoning behind why we're recommending this is that based on your responses to our cardiac stress tests and some other tests we've done, such as an electrocardiograph, they've been inconclusive, so it's prompted us to do a little bit further investigation to see what some of the underlying causes of your chest pain are and really get in there and see exactly what's going on. So I'm just going to kind of brief you on what to expect tomorrow and during the procedure, etc. So tomorrow, once you come in, we'll get you in the gown on the bed underneath some X-ray equipment, and we're going to go ahead and sterilize. Our access point is going to be here in the groin area, so I'm going to go ahead and sterilize that and give you a local anesthetic. And then we're going to use the method which is known as percutaneous cardiac catheterization as opposed to cut down, but you don't need to worry about that. So I'm going to insert a hollow needle into your blood vessel here in your groin, and once I've reached the vessel, I'm gonna insert a flexible wire through that needle, remove the needle, and then take a sheath about 6 inches in length, sheath over that wire, remove that wire, and then I'm going to take a catheter, thin, narrow catheter, through that sheath into this blood vessel, and I'm going to feed it up to the right ventricle, and I'll have access to the right and left ventricle. And it'll, with the X-ray equipment that'll be off to the side, I'll be able to guide it right through there and see exactly what is going on right in there. And once I'm there, I'm gonna release some dye, and the purpose of this is so it can provide us with images to be used post-procedure to show exactly what's going on. This is known as angiography, which you don't need to worry about, but it's just kind of the equivalent of taking an X-ray of the musculoskeletal system. So, and I'm also going to be taking some tissue and blood samples while I'm there, just to have, it'll be useful post-procedure. The biopsies can be taken to the lab to see if anything is of note there. But what we're really going to be looking for is for some blockages of the arteries, whether that's stenosis, which is going to just be the narrowing of an artery, or with an actual thrombosis, or like an erythema, a buildup of plaque. So if we get up there and I see some plaque, there are a couple things that we can do if it's nothing that's exorbitant, if it's something that can be dealt with right there. I'm going to go ahead, of course, with your permission, and insert another catheter, this time with a balloon tipped on it, and we're going to perform what's known as an angioplasty. So once that's fed up to the site of the blockage, the balloon tipped catheter is going to reach the plaque buildup, it's going to expand, and it's going to push that plaque to the wall. It's going to break up that plaque and push it to the wall, which is going to open up that artery and increase the blood flow, which is going to relieve majority of your chest pain or your angina, just the medical term for it. And then I'm going to go ahead and place a stent, a drug elucidate stent, because the research has shown that these, as opposed to metal stents, are far more likely to reduce restenosis or re-narrowing of the artery or plaque buildups, things like that. So that stent is going to stay there permanently, which is fine. The blood vessel will heal over it. It'll eventually, it'll just become part of it, so to speak, and that'll really open up the valve or the vein. So that's what's going to happen if I come across a blockage like that. And I'm just going to go ahead and perform an angioplasty. It's a very simple procedure. We'll be able to take care of it right there. What I encounter could require something more than that, but we'll cross that road once we get there. So after that catheterization procedure, I'm just going to remove the catheter. You'll go ahead and be sutured up right here, and we will require that you stay in the hospital for bed rest for about 7 to 24 hours. And we'll be applying some local pressure to prevent bleeding of the wound, and you will be able to return to work in 3 to 5 days after that. But you will need to be in the hospital, receiving rest about 7 to 24 hours after that. It's a very common procedure. I just kind of wanted to calm some of your some of your worries that you might have. I know people get worried about any sort of surgery procedure, but this is very minimally invasive, very, very routine. I've performed many, many myself, um, and this is just to see exactly what's going on in there, because I know that you're experiencing that chest pain, and I know that this procedure is gonna not only tell us what's going on, but if we do run into something, we'll be able to take care of it, whether that's tomorrow when you're here, right then, or schedule a follow-up if we need to. So that's what you can expect tomorrow. The procedure takes about an hour. Notwithstanding something extra that we think we want to take care of right then, it takes about 30 to 60 minutes. So budget that sort of time. So that's basically what we're looking at. So I'll just go ahead and plan on seeing you here tomorrow.